What to expect from sex after birth? How long do you have to wait? Post-delivery hormonal changes may make vaginal tissue thinner and more sensitive. Your vagina, uterus, and cervix have to return to normal size, too. And if you're breastfeeding, that can lower libido. In short, your body needs some time off after delivery. There is no definitive timeline that says how long you should wait. However, most doctors recommend women wait 4 to 6 weeks following a vaginal delivery. After your doctor has given you the all-clear to resume sexual activities, you may still need to take things slowly. Remember, in addition to physical recovery, you'll also be adjusting to a new family member, less sleep, and a change in your regular routine. You may also need to wait longer if you have a perineal tear or episiotomy. An episiotomy is a surgical cut to widen the vaginal canal. Returning to sex too soon may increase your risk of complications, such as postpartum hemorrhage and uterine infection. Sex after delivery will feel different. One small study from 2005 found out that 83% of females experienced sexual problems in the first 3 months after their first delivery. However, that number continues to fall as the post-pregnancy months increase. The most common issues with sex after delivery include: hormones play a big role in post-delivery recovery and a return to normal sexual activity. In the days immediately following childbirth, estrogen drops to pre-pregnancy levels. If breastfeeding, estrogen levels might sink below pre-pregnancy levels. Estrogen helps supply natural vaginal lubrication, so low levels of the hormone increase the likelihood of vaginal dryness. Dry tissue can lead to irritation, even bleeding, during sex. This increases your risk of infection. Vaginal birth can temporarily stretch the muscles of the vaginal canal. These muscles need time to recover their strength and stability. If you had a perineal tear or episiotomy during vaginal birth, you may have a longer recovery. Having sex too soon can increase your risk of an infection. A cesarean delivery can also affect vaginal sensation. The same hormonal issues can make the tissues of the vagina dry and thin, possibly leading to painful sex. Plus, you'll be recovering from abdominal surgery, so you'll want to make sure the incision site has properly healed before resuming sex. You can get pregnant surprisingly quickly after delivering a baby. One study found the first ovulation for women who weren't breastfeeding is around 6 weeks. Some women ovulated even earlier. If you are breastfeeding, the normal hormonal benefits of nursing can act as a natural form of birth control for the first 4 to 6 months after delivery. However, only about 1 in 4 women who use this lactational amenorrhea method, LEM, or breastfeeding as birth control, actually do so properly. That increases their risk for pregnancy. If you are going to have sex after pregnancy but don't want to risk another baby so soon, plan to use a reliable method of birth control. A barrier method such as a condom may be good to use at first. However, hormonal options may affect breastfeeding and can also come with certain risks, such as an increased risk for blood clots. Getting pregnant too quickly after one pregnancy can put you at an increased risk for premature birth or birth defects. Healthcare professionals encourage women to space their pregnancies. It is recommended to wait at least 12 months between each pregnancy. In some quarters the recommended time is 18 months. If you're thinking about another baby, talk to your healthcare professional. They will be most familiar with your health history and offer more personalized recommendations. In the weeks immediately following childbirth, you'll likely experience some regular bleeding as your uterus heals. Sex may cause some additional blood loss. Likewise, your vagina may be drier and more sensitive in the early weeks after childbirth. This makes the muscles thinner, which can lead to tearing or injury. The vagina may even become inflamed and swollen. In these cases, bleeding isn't uncommon. If the bleeding during sex doesn't stop within 4 to 6 weeks or it worsens, see your doctor. You may have a tear or irritation that needs treatment before you begin having intercourse again. The hormones estrogen and progesterone are crucial to your baby's healthy development during pregnancy. They also happen to be vital to your sex drive. Levels of these hormones are incredibly high during pregnancy. Once the baby is born, they decline dramatically, back to pre-pregnancy levels. That means you may not feel any sexual desire for a few weeks. But you should be waiting 4 to 6 weeks anyway, as your body recovers. After your has given the all-clear to resume sexual activities, you may decide to wait longer before reigniting your sex life.